On the Health Watch now, medical price websites are on the rise. These sites help patients find cash prices for certain medical procedures.
And some patients are saving thousands of dollars, but quality may be sacrificed. CBS 4's Cynthia Demas explains why.
Matt Hutchings had a cough that just wouldn't quit. After going to the doctor, he learned he had a more serious condition than he expected.
They found out I had Barrett's esophagus, and that's where the acids in your stomach come up.
The condition can sometimes lead to cancer of the esophagus. So the specialist recommended surgery to correct this. But even with his insurance, it was going to cost him up to $60,000 out of pocket. With the help of his insurance company, Matt was able to price match the procedure.
Then we come to find out that there was a lot of other hospitals and doctors that would do it for a much less price.
Matt used a company called MediBid. MediBid is one of the growing number of healthcare bidding websites where doctors can place bids for various procedures.
The goal is to make healthcare more accessible, affordable, allow the employee to really see the quality and make an informed decision.
Ralph Weber started MediBid in 2010 because he felt there was a lack of transparency in healthcare. For a fee, the site lets patients search through prices providers submit for various procedures.
We saw a need for having competition so that people can compete based on quality, based on price, and based on location.
Other sites like Clear Health Costs and Polkadot also help consumers find prices for medical procedures. But could these types of sites compromise quality of care?
Patients may not do their due diligence. We're also worried that even if they research their doctor, they may still go for the lowest bid. And less expensive is certainly not a guarantee of quality. On the same token, more expensive isn't a guarantee of high quality.
Matt ended up going to a specialist out of state and paid significantly less than the original quote. The surgery was a success. It took some extra research and travel, but Matt says he'd do it all over again.
They were excellent, and then I came out 0-0, which was awesome.
Donovan points out these bidding sites may not be very helpful to a patient without insurance, since the prices may still be just a little too high for someone to pay on their own. In the newsroom, I'm Cynthia Demas, CBS 4 News Tonight.
Well, we, of course, don't want them to miss our